Well, thank you to everyone for joining us today. And I'm really excited to be with this great panel of Wisconsinites talking about an issue that is top of mind for so many people right now, healthcare. Wisconsin is a national red zone for COVID-19 infections. We're experiencing our worst outbreak of infections since the pandemic began, breaking records for new cases, hospitalizations, and deaths. Right now, people in Wisconsin want their health care protected during this deadly pandemic that has already taken 1,633 lives in our state. But Mitch McConnell and Senate Republicans are rushing toward a vote on the president's Supreme Court nomination to do what Trump wants, terminate the Affordable Care Act. And the fact is that President Trump supports a lawsuit to overturn the Affordable Care Act completely, including the guaranteed protections for people with pre-existing health conditions. On November 10th, the Trump-backed lawsuit will come before the Supreme Court of the United States. And Judge Barrett has a record of opposing previous Supreme Court decisions upholding the Affordable Care Act. And here's what's at stake if Trump and Senate Republicans get their way. 135 million Americans with pre-existing health conditions could lose their guaranteed protections, including more than 2 million Wisconsinites. More children have become uninsured in every year of the Trump administration, and striking down the Affordable Care Act would be the final devastating blow to children's health care. Should Trump and Republicans succeed in their lawsuit, an estimated 800,000 children would lose their health insurance. Young adults would no longer be able to stay on their parents' health insurance plans until they turn 26. And recently, I heard the story of Amy from Neenah. Amy's daughter is a college student at Marquette studying nursing and is currently on her mother's health insurance plan. They're worried that without the ACA, this nursing student would be kicked off her mother's insurance and lose access to health care. Insurance companies could again be free to charge higher premiums and offer fewer benefits for the 133,500 Wisconsin women under age 65 who are covered through individual market plans. We're facing the worst public health crisis in a generation, and instead of working to make things better, President Trump wants to take people's health care away with this court pick. Over 178,000 Wisconsinites have been infected with COVID-19, which could now be considered a pre-existing health condition. These people need the guaranteed protections that Affordable Care Act provides. And in Wisconsin, over 40,000 young adults in their 20s have been infected with COVID-19. Many of these young people are likely on their parents' insurance plan, but without the Affordable Care Act, they would be kicked off their parents' insurance health plans and left to fend for themselves. We're here today to make it clear that Wisconsinites do not want President Trump to take people's health care away in the middle of a deadly pandemic. We don't want to go back to the days when insurance companies wrote the rules and could choose to deny people coverage, charge people more, or set annual or lifetime limits on people's health care. So today I'm joined by some important leaders from Wisconsin who will be able to speak to what's at stake for women's health, children's health, and guaranteed protections for people with pre-existing conditions if President Trump and Senate Republicans force through their nominee for the Supreme Court. So now I'm going to turn it over to one of Wisconsin's healthcare champions and my friend, Representative Jimmy Anderson.
Thank you, Senator Baldwin. I really want to just thank you for this opportunity to be able to share with you and with everyone listening today my story. You know, it was back in 2010 when I wanted to go home and visit my family. It was the summer between my second and third years of law school, and flew home to go and celebrate my birthday with my family. And as we were going out, we were hit by a drunk driver. Um, I lost my mom, my dad, and my little brother that day, and I was paralyzed from the chest down. I remember one of the first things I ended up remembering coming out of my coma after they'd done my spinal fusion surgery was the hospital administration coming to me, telling me what had happened. I had had a severe concussion. I actually didn't remember the accident at the time. Uh, and right after that, saying that you are already nearing your lifetime maximums and you are going to end up getting kicked off your health insurance very soon. And it was terrifying. I was a law student who had more student debt than savings. I didn't know what I was going to be able to do to be able to afford my wheelchair, which was going to cost tens of thousands of dollars, my hundreds of thousands of dollars of remaining rehabilitation. And not only that, but knowing that I was going to be someone with a spinal cord injury for the rest of my life, how I was going to be able to maintain my health care and my health insurance going forward. And so it was 2 days of just pure depression and terror on top of already having lost my family. It was too much to bear. But luckily, 2 days later, I got another letter from my health insurance company saying that the provisions of the Affordable Care Act had just kicked in that got rid of those lifetime maximums. I can't explain how important that was to me, to be able to take all of my time, my effort, my strength, my spirit, and focus it on getting better, rather than having to sit there and wonder what I was going to be able to do to try to afford my healthcare coverage. And going forward, I was able to put my life back together, be able to start a nonprofit to help victims of drunk driving, finish my law degree, and eventually was inspired to run for office. And now I luckily get to try to continue that fight for continuing providing healthcare coverage for people here in the state of Wisconsin, and trying to help Senator Baldwin try to expand that to the nation as a whole. And, you know, it's not just my particular story. You know, there's people with disabilities that are going to be, if we reinstall those annual caps, would be hitting those annual caps every year and struggling very mightily, as we've seen here in the state of Wisconsin, which is pretty much the epicenter of the COVID-19 outbreak. There are lots of young people that are depending on their parents' health and coverage to be able to not only get the help themselves, but to be able to not have to worry about getting hit for pre-existing conditions going forward. And so I say that we need to do everything we can to defend the Affordable Care Act, to build on its legacy, and to make sure that we don't go back to the bad days of when health insurance companies could discriminate and kick people off their health insurance plans.
Thank you so much, Jimmy. What a powerful story. Next, I want to recognize Sarah Finger. She is the Executive Director of the Women's Alliance the Wisconsin Alliance for Women's Health.
Thank you, Senator. I am just so incredibly honored to be represented by you and Representative Anderson. Representative Anderson is my own representative in the state capitol. And I'm so incredibly grateful for your leadership on healthcare issues and others. What I'm here today to talk about as part of the Alliance for Women's Health is that, you know, the healthcare reform has been a women's health issue. And, you know, we have to be honest. What we know right now is that compared to men, women on average have more interactions with the healthcare systems over their lifetime. You know, before the Affordable Care Act, 1/3 of women who tried to buy a health plan on their own, well, they were turned down or charged more, higher premiums because of their health, or had actually specific healthcare problems excluded from their plans. And so the pre-existing condition aspect, or just being a woman, was a pre-existing condition before the Affordable Care Act. You know, not only, again, in terms of our role and our unique healthcare needs, but we also are really playing a role as family care providers in the world. I know myself, I just got our kids in for flu shots last week, and I'm coordinating care for them. I'm helping with my dad who's recovering from surgery. We play that very important role. And so this is a very personal issue for women in Wisconsin. You know, before the Affordable Care Act, you think of some of our healthcare needs that were basic healthcare needs. Only 12% of plans that were out there in the individual marketplace offered maternity coverage. And so for those individuals who did not have that coverage, without the maternity care, those out-of-pocket costs jumped from 1,000 to 3,000%. And luckily, I had my daughter in 2010. I remember coming to meet with you in the Capitol. I was pregnant with her, Senator Baldwin. And I had my son in 2013, and luckily I did have that maternity coverage, but I can't imagine that incredible choice and that financial threat to families and women before the Affordable Care Act. Basically Wisconsin win for all the reasons Wisconsin women and women across the country win with the Affordable Care Act because of all the reasons already mentioned. But I do again want to emphasize the preventative care that was offered with the Affordable Care Act, where cancer screenings, domestic violence screenings, breastfeeding support, all of that was offered at a base level with no out-of-pocket cost. And that was huge for us as women and all of our healthcare needs, and for our children, and again, our families' healthcare needs. Representative Anderson mentioned the lifetime limits for individuals who have had cancer, running out and having to all of a sudden hit a wall when you're struggling with ovarian cancer, cervical cancer, breast cancer. And then again, the essential health benefits, setting that base where maternity care was going to be covered. And again, we just could not be discriminated against just purely on the basis of our gender. And so we continue to, we know when we, passed this back in 2010 that this wasn't going to be a one and done and we can sit back and relax. You and I have talked about that before, Senator Baldwin, that it has been a nonstop fight to defend and to implement and to have compliance with this really powerful piece of legislation. And we have yet to meet the full promise with Medicaid expansion in our own state like Wisconsin. And so the last thing we need right now is to go back to a time when we had this just horrendous system working against people at every level. And I refuse to let us go back to that time before the Affordable Care Act.
Thank you so much, Sarah. Now I want to introduce William Park Sutherland. He works for Kids Forward as the Health Policy Engagement Coordinator. William, thanks for joining us.
Thank you so much for having me, Senator Baldwin. Kids Forward is focused on protecting and expanding access to healthcare and health coverage for every kid and every family and every community in Wisconsin. All the speakers have, really pointed out, how important the Affordable Care Act is for people in our state. I wanted to say a couple more things about how the ACA protects people with pre-existing conditions, because I think there's a misnomer that state level fixes can sort of provide the same level of protection. And the Affordable Care Act really does provide more than just coverage for pre-existing conditions. It makes that coverage affordable through the health insurance subsidies. And like Representative Anderson said about preventing annual and lifetime caps, and then also making sure that those consumer protections that Sarah was talking about are applied to almost all insurance plans across the country, including plans that are exempt from state level regulation. And so that's another really important piece of the Affordable Care Act. The ACA provides coverage to about 195,000 Wisconsinites right now. About 26,000 of those people are children or young adults that are under the age of 25. And so all those people, would be at risk if the ACA were overturned or if it were repealed. But aside from that, there's other benefits that the Affordable Care Act provides to people who are all over the state and not necessarily just in those health insurance plans. So like Sarah talked about, requiring preventative care services for children and adults to be delivered free of charge is really, really important. It's especially important during a pandemic where we've already seen the rate of children's vaccinations going down and people not getting that preventative care. And so it's vitally crucial that we eliminate as many barriers for children getting the care they need and getting their vaccines and getting routine preventative care. The other thing that the Affordable Care Act does that's really important is it requires health insurance plans to spend 80 to 85% of their premium dollars on actual medical care or quality improvement. And when those plans, don't do that, they have to actually pass that money back to consumers. And, that is also something that really makes sure that health insurance dollars are going to provide health care, which is really important and another significant benefit. So the ACA is, of vital importance to everyone in the state, regardless of whether or not they're in the health insurance marketplace, regardless of whether or not they're children who are on their parents' insurance plans, or they're women and other folks who are needing those essential health benefits like maternity care and prescription drug coverage and mental health coverage and substance use coverage. And all of that is at stake if the ACA is overturned. Kids Forward is actually working on a report on what's at stake for the health insurance marketplace in the ACA that will be coming out in the next few days. So thank you again so much.
Oh, thank you to all of you. So I now want to open up the opportunity for members of the press to ask any questions of myself or the panel. How long do teachers wait for in the classroom? It may be a tribute to the fact that everyone spoke so eloquently and comprehensively that there aren't any questions.
I am not showing any questions in the chat. So at this time, we will go ahead and end the call, and any follow-up questions from press can be directed to Senator Baldwin's press office.
Thank you all so much. Really powerful testimony. Thanks.